Hi friends, I am Joel John from Joel John J YouTube channel, and in this video we are going to look at a part in medical coding, that is HCC coding. HCC coding. I will tell a short about this and then get into the topic. Before that, press the thumbs up icon, text your comments like what are all the things you like to know more about medical billing, what are the types of video you like, and anything you can share on the comments, but be respectful on comments and stick to community guidelines of YouTube. Then whatever the queries you have, you type it on comment. I will try to reply on that while watching the video as well. Press the share icon and share this with your WhatsApp groups and other social media, and ask your friends to subscribe. And if you haven't subscribed, subscribe and enable all notification so that you get all my new video updates on your YouTube inbox notification. Okay. Now getting into HCC coding, I will tell short about the HCC coding, and then we'll start going through the script. And this is mostly like a question and answer kind of section which I have prepared for HCC coding, because mostly people this coding knowledge is not much required for people who are on other domains of medical billing, as this is done mainly for the insurance company to estimate the future cost which will be incurred by for it to settle the claims. That is, what are all the future medical expenses of the enrollees of a medical insurance company based on their past medical history, their health condition, and few demographic factors like age, sex, and region. They classify them into some HCC code groups and do a risk factor analysis. And if the risk factor score is less than 1, the person is less likely to have a huge medical expense. So that's the overall concept of this HCC coding. This is also done by individual doctors, so that they can they also have some criteria like they have to reduce their patients' medical costs, right? That's the ultimate goodwill of healthcare team. And also there are different types of payments in insurance. About that, we look into on a separate video because the videos are going much longer. For people who are listening to the voice alone on podcast, you can search as Joel John J. I will spell it out: J as in Jack, O as in Oscar, E as in Echo, L as in Lima, space J as in Jack, O as in Oscar, H as in Hotel, N as in November, space J as in Jack on the YouTube search box, and you can identify the channel with my photo and the same for, and then click on that, and my YouTube channel name also will be on the uh, screen profile picture, so it'll be easy for you to find out. Go into the YouTube channel and watch the video as well, because you can look at the text as well. In addition to that, while we are reading the question and answer, and also you can take notes of it. Okay, so now getting into the topic, HCC or hierarchical conditional category coding in US medical billing, the frequently asked question. HCC coding relies on ICD-10-CM coding to assign risk score to patients. HCC is mapped to an ICD-10-CM code along with demographic factors such as age and gender. Insurance company use HCC coding to assign patients a risk adjustment factor, or AF, that is risk adjustment factor score. When did HCC coding start? Hierarchical condition coding, category coding, or HCC coding. I repeat, hierarchical condition category coding, or HCC coding, was first implemented by the Center of Medicare and Medicaid Services, that's shortly CMS, in 2004 as a way for medical groups to estimate a patient's future medical care cost is value-based payment modules. What is ICD-10-CM codes? ICD-10-CM, International Classification of Diseases, 10th version, clinical modification, is system used by physicians and other healthcare providers to classify and code all diagnoses, symptoms, and procedures recorded in conjunction with hospital care in the United States. What does ICD-10-CM do? The ICD-10-CM is a morbidity, the condition of suffering from a disease or medical condition. Classification published by the United States for classification, diagnosis, and reason for visit in all healthcare setting. The ICD-10-CM is based on the ICD-10, the statistical classification of diseases published by the World Health Organization. What is the difference between ICD-10 and ICD-10-CM? There is no difference between ICD-10-CM and ICD-10. In fact, when most people are talking about ICD-10, they are speaking of ICD-10-CM. ICD-10-CM is medical coding set for diagnosis, condition, and is used in all healthcare establishments in the United States, that's US. Okay, friends, what is the difference between ICD-10-CM and ICD-10? In short, if I have to tell, or in this is the correct one answer. Instead of telling us ICD-10-CM, people shortly tell it as ICD-10. Okay, clear now? So in the interview, anybody asks this question, both are the same. Instead of saying as ICD-10-CM, some people say it as ICD-10. That's it. Okay. Now then, continuing with that, what are the roles of HCC medical coders? HCC, that's Hierarchical Condition Category Coders, helps hospitals and other healthcare facilities track patients' information in order to send correct bills and maintain accurate records. This job may include looking back at patient records to ensure accuracy, keeping database organized, and using specialized classification softwares. How does proper HCC coding benefits? Correct coding, HCC predicts the future financial resources for patient and ensures appropriate reimbursement for a physician, which is always good for your revenue cycle performance. Who uses HCC coding? HCC or hierarchical coding categories are sets of medical codes that are likely to specific clinical diagnosis. Since 2004, HCCs have been used by Center of Medicare and Medicaid Services (CMS) as part of risk adjustment modules that defines individuals with serious acute. The serious acute means very serious condition. Okay, in Tamil we call it as kadumayana. Kadumayana noi. That's called as acute disease or chronic. That is a disease that is persistent or otherwise long-lasting in its effects, or a disease that comes with time. In Tamil, we call it as nalpatta condition. So chronic conditions. So what is chronic conditions? Mostly you call them as pre-existing not covered, pre-existing diseases covered, right? That's something related to chronic conditions. Okay. So in Tamil, nalpatta no in some TVs and cinemas, I think we would come across this. Just now I know the meaning after studying this. Thanks for that. What is commercial HCC coding? Hierarchical condition category coding or HCC coding was implemented by the Center of Medicare and Medicaid Services (CMS) in 2004 to help estimate the healthcare cost of Medicare enrollees in the upcoming years. That is, they implemented this. The HCC coding was initially implemented, and this has a commercial value. That is, this enables the Medicare and Medicaid services to estimate what will be the medical cost the Medicare is going to pay for the patient, right? So how much they will be paying for their patient in the next year, how they calculate it, that's based on this HCC coding. What is commercial HCC coding? It has a commercial value, right? So it's also called as commercial coding. And in insurance, US healthcare, we call private insurance companies as commercial insurance. So do they commercial insurance also use HCC coding? Yes, they do. Why they use? Now we're coming into that. Now commercial insurance is also using HCC coding to estimate how much claims they may have to pay in the future and to fix premium based on that. They should have to arrive a calculation to know what's the premium rate, right? For that, they do the HCC coding system. Which risk adjustment module is used for commercial plans? The commercial risk adjustment payment module is designated to be a risk stabilization program. In that, a plan collects premiums from its enrolled members, but funds are distributed from plans with low-risk enrollees to plans with high-risk enrollees. What is HCC claims? Hierarchical Condition Category HCC coding is a risk adjustment module originally designed to estimate future healthcare costs for patients. What is risk adjustment? A statistical process that takes into account the underlying health status and health spending of the enrollees in an insurance plan when looking at their healthcare outcomes and healthcare cost. What is risk adjustment code? Risk adjustment is an actuarial tool to predict healthcare cost. Hierarchical Condition Category HCC coding is a risk adjustment module created by the Center of Medicare and Medicaid Services to estimate further healthcare costs for patients. How does HCC coding benefits? HCC coding is the CMS risk adjustment payment module that enables more effective projections of further costs for certain Medicare Advantage, Medicaid, and ACA members with acute or chronic conditions. Incentivize providers to keep higher risk patients healthier can help drive down cost and improve outcomes. How do I increase the HCC code? So this is something for the providers. They have to follow this to improve the HCC codes. 5 steps to improve HCC codes and risk adjustments. Having an accurate and updated problem list. See patients at least once a year. Public education and information dissemination, spreading information. EMR, electronic medical record, optimization, and better decision assistance. Monitoring performance and spotting potential. How often are HCC scores calculated? Each year, CMS evaluates and updates the HCC model to incorporate changes in the diagnostic codes and are mapped to in HCCs. Periodically, CMS estimates a new HCC module that is used to calculate a risk score for each beneficiary. What is TAMPER in HCC coding? TAMPER, T-A-M-P-E-R, TAMPER. TAMPER stands for Treatment, Assessment, Monitor or Medicate, Plan, Evaluate, or Referral. So T in TAMPER stands for Treatment, A in TAMPER stands for Assessment, M in TAMPER stands for Monitor or Medicate, P stands for Plan, E stands for Evaluate, R stands for Referral. So TAMPER helps coders address diagnoses in question that are presented in a list or not noted with a history of description. What are the 4 risk adjustment return measures? There are 4 key risk adjustment performance measures. They are alpha, spare ratio, trainer ratio, and information ratio. It is very important to factor in risk while evaluating a portfolio performance. How many ICD-10 codes are HCC? Of approximately 70,000 ICD-10 CM codes, this is very important, note down, there is approximately 70,000 ICD-10 CM codes. So don't try to memorize all this. Just look for what's the correct ICD-10 codes based on the doctor notes, what is the patient history mentioned, what are the diagnoses the doctors has found out, and what are the disease the doctors has mentioned that this patient is suffering from. ICD-10 is given by the disease and symptoms and the patient medical history. Okay. So based on that, search on the proper checklist or using the proper software tool and update. Don't depend on your memory. So now again, of the approximately 70,000 ICD-10 CM codes, about 9,500 mapped to 79 HCC categories. The diagnosis must be documented by the physician who provide care. A risk adjustment factor is assigned to each HCC category. What are the types of HCC coding? 3 varieties of HCC coding review are prospective, concurrent, and retrospective. What are the 3 varieties of HCC coding reviews? I repeat, prospective, concurrent, and retrospective. Coding reviews are essential for financial success, value-based contracts. What is prospective HCC coding? A prospective coding review process is intended to help physicians prepare for the upcoming patient encounters. Reviews, who are often certified risk coders, evaluate the patient's HCC code history, prescribing drugs, hospital records, lab results, and physician notes. So, before a patient is scheduled for a doctor visit, this HCC coding will help to, understand that how much this the patient will be spending for the medical expenses in the upcoming year. Okay, that's called as prospective HCC coding. What is concurrent module in HCC? HCC is basically a concurrent module that requires patient diagnosis of the current benefit year to determine their medical and drug expenditure for the same year. The risk adjustments for these patients includes parameters like demographic, health condition, and financial status. So this is concurrent means concurrent year, the current year. So what's the patient going to spend on this current year? That study is called as concurrent module of HCC. What is retrospective HCC? Anything retrospective involves a look back. So retrospective HCC is look back. So for providers or retrospective HCC coding, reviews occur after patient care has been delivered and claim information submitted by the payer. A comprehensive retrospective approach will review both patient charts and the submitted claims data. So what is this review? This is a kind of validation. Retrospective HCC means it's a kind of validation coding. What they do, they analyze, they look back of the providers. The patient has come to the provider and he has finished the spending for the year. So now what they are going to do, we have something called as pre-analysis, comprehensive report, which includes the patient charts or HCC reports. That's what they have put some charts and said that this much amount is going to be spent by the patient and this is the expenditure cost. And now the claims are submitted, claims are validated, and payments are done. So now we have got the real expenditure happen. So these two are going to be compared. Where we are going to look back, that's look back. We are going to look back both that. That's going to compare on the retrospective HCC coding. So now now we are going to have again look at the three varieties of HCC coding reviews. One is prospective, concurrent, and retrospective. Prospective reviews process, which is physician prepare for upcoming encounters. What are all the upcoming encounters this patient is going to have in this particular year, based on what they are going to study of this HCC code history, prescription drugs, hospital records, lab results, and physician notes. Based on that, they are going to say how many times this patient is going to come and what are all the probable diseases and health issues this patient will encounter on this current year. Then now and the upcoming year. And now we are going to come out the current year. That's concurrent year. That's called as concurrent module in HCC. In this, what they do, they review the patient diagnosis and the current benefit year and determines the medical and drug expenditure which are going to happen on the same year. Okay. We are adding parameters like health condition and financial status. Retrospective HCC is look back. Look back at the HCC modules. That's how those are the patient charts which the HCC coder has submitted, assuming that this much expenditure are going to happen. Now the year is over. So we have counted the claims processed, payments done. So now we know how much claim is being submitted and how much is the allowed amount and how much we have paid. So we are going to compare both and look back. So that's called as retrospective HCC. Which code set is used for HCC coding? ICD-10 code sets. Hierarchical Coding Category HCC medical coding utilizes the ICD-10 code sets. This is used to identify risk for each patient and assign risk values or RAF, risk adjustment factor score, is value-based care module. What is HCC risk score? The CMS HCC risk score for a beneficiary is a sum of score or weighted attribute to each of the demographic factor and HCCs within the module. The CMS HCC module is normalized to be 1.0 point. Beneficiaries would be considered relatively healthy and therefore less costly with the risk score whichever is less than 1. Whichever score less than 1 are healthy people and they are going to have less medical expenses. Why are HCC codes important? In addition, the HCC codes predicts healthcare cost utilization. The financial impact of optimization, HCC coding is significant, is as it directly impacts money received by the healthcare organization from the largest single player in the healthcare, that is CMS. What is the role of HCC coder? HCC coders help hospital and other healthcare facilities tracks patient information in order to send correct bills and maintain accurate record. This job may include looking back at patients' records to ensure accuracy, keeping database organized, and using specialized classification software. So people, we have finished looking at what are all we have planned to discuss on the HCC coding. And as I have done a lot of videos on US medical billing at the end screen, I will soon put all those videos, whichever I have made about the US medical healthcare, US medical playlist, which will have all the videos I have made about that. And if you are not getting it on the end screen, just click on my name or photo below. It will take you to the channel page, or search on YouTube, search box as Joel John J, and find out my videos and go to the playlist. Click on my channel and go to the playlist, and on that there will be US medical billing playlist and other things like demo and charge entry, for payment posting, for evaluation, eligibility and benefits, and all those I have made separate playlist as well. The US medical playlist will have all the video added to it. So if you go to that, you'll be able to watch all the videos. Okay, friends, press the thumbs up icon, press the share icon, share it with your friends, and always discuss about these things with your friends. That's when you will remember whatever you have seen on this. So send my videos to them, and I have an open conversation with them. Connect with them on social medias and talk about this, and talk about the various terms and what you think about this hierarchical coding category. And there are also few other medical coding related videos which I'm going to upload as well. So watch those as well. And this is something where the insurance company itself hires, and also the doctors as well hire. So HCC hierarchical coding category is really a beneficial process to learn. And wish you all a lot of success in your interviews and much more. And even certificate coders forget something, and instead of moving to the books, if they don't have time to look at the notes, and some people are missing out their notes as well. Notes are very important. Even I have lost a lot of notes. I agree. Try to take a printout and places wherever it's cheaper, and put a file binding and keep it. And also have you have email IDs, right? If your office permits, don't go and take something confidential in your office and tell that this is the YouTube blogger Joel Janji has to do all those things. And like if you come across with your friends, if they have some notes prepared, like I am preparing notes and I am sharing the video, like that, there are also a lot of PDFs available on Google and something, and open sources. So search and collect the PDF and read whenever you are on the free time. Improve your knowledge. Knowledge is something which will keep up the man perfect. Okay. Okay, friends. It's time to say bye. And so Joel John G signing off from you. Bye.